Welcome to the 14th podcast of the Merseyside Pensioners Association, recorded on the 10th of October 2020. It's not just for pensioners, but for everyone. In today's programme, we take the mask off Health Minister Matt Hancock, who's been tasked with privatising the NHS and ensuring that public finance flows seamlessly into the pockets of private companies for the benefit of their shareholders. We talk to the underpaid, undervalued and exploited health workers who work tirelessly to keep our NHS going. We have an exclusive interview with Matt Hancock himself and speak to the plumber who's been stuck in the Health Secretary's house for several days. This podcast was established 6 months ago in response to the pandemic and to provide a platform for alternative discussion, news and comment. Back then, guests on this programme warned of the potentially disastrous consequences of Tory government policy on the population of the UK. Since then, we've had many thousands of needless deaths, rising unemployment, and the spectacle of billionaires getting richer on the back of the pandemic. Disaster capitalism has come of age, and we've watched the economy shrink by 22% amid the COVID chaos. As the government runs the UK on behalf of the 1%, we've seen a building anger against a system that creates inequality, division, and is leading us towards an environmental catastrophe. The government has blood on its hands for thousands of avoidable deaths, and thankfully, health workers are fighting back. Earlier, I spoke to Merseyside student nurse Laura Hother about how she thought the government were treating health workers.
People have trauma from the things they've seen. It's really emotional when you think back to the things you've seen, and people aren't just going to forget about that. Nurses and NHS workers all deserve a 15% pay rise. This is an absolute minimum. We deserve 15% pay rise as we've had a 20% pay cut in real terms since 2010. This included a 10-year pay freeze. We work really hard, long hours. We have mental and physical health problems from the shifts we work. We don't get to see our families when we want to. We miss out on occasions. We just dealt with this invisible virus in an absolute war zone of wards that were already hit with by cuts. We've had lack of equipment and we still managed to look after people and get through this COVID crisis. The government did not get us through the COVID crisis. It was all our key workers and it was all our NHS staff that did. And this is why we all deserve our 15%. And if you want to keep your NHS public, and if you want to keep your NHS staff valued, and you want to keep the Tories from destroying our NHS, then you need to back our 15% campaign, because we want to keep and retain our staff and we need to keep our patients safe.
That was the powerful voice of student nurse Laura Hother outlining the demand for a 15% increase for all NHS staff.
I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
Keep calm and carry on. That's what I did. They wanted me to come out and scream, people are dying, we're dying. No, we did it just the right way. We have to be calm. We don't want to be crazed lunatics.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do, either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning, because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
The bizarre pronouncements of President Trump in relation to the coronavirus might perhaps cause you to think, well, at least it's not as bad over here. Well, over here, politicians have lied consistently to the public.
We will have a test, track and trace operation that will be world-beating, and yes, it will be in place. It will be in place by June the 1st.
We're building an army of human contact tracers who can man the phones and find the contacts and support people.
NHS Test and Trace is one of the most ambitious and complex projects that any of us have ever worked on. It's brought together so many people from all walks of life to work together on this common goal.
Those were the words of Boris Johnson, Matt Hancock and Dido Harding, the woman hired by the government to implement what they all call NHS Track and Trace. Well, of course, it's got nothing to do with the NHS. It's just a huge money spinner for companies like Serco. Billions has been handed over to private companies for a project that has failed lamentably. We shouldn't be surprised at this because Harding is a former chief executive of the Talk Group. Some of you might remember that she faced calls for her to resign after a cyber attack revealed the personal details of 4 million Talk customers. Unsurprisingly, she's a member of the Tory party and is married to Tory party Member of Parliament John Penrose and is a friend of former Prime Minister David Cameron, who appointed her as a member of the House of Lords in 2014. She's also on the board of the Jockey Club. All of which, of course, makes her eminently qualified to have a critical position in ensuring that the pandemic works well for the rich, no matter what the cost is for the rest of us. Interestingly, she was raised on the family pig farm in Dorset. MPA member Paul Philby can see worrying parallels with the economic situation today and the 1930s.
You know, the fascist regime lasted from 1934 to about 1942. Once the German force had been knocked back from Russia and America had joined the war, it was game over. So, 80 million people died worldwide and about 50 million people in Europe because of this gangsterism that the leading capitalists put their faith in. Now, as I'm not saying we're at that stage, but the socialists became liberals, the liberals became Tories, and the Tories became fascists. Whereas most people in the labour movement are self-sacrificing, we want a better future for our children, we want a better society, and we understand and have got good arguments to explain how that can be achieved economically without hurting anybody. I don't know, as the economic situation gets worse, then I'm sure these people will start coming out the woodwork, pointing their fingers at immigrants, Muslims, and the left. They always blame the left. So this is what happened then, and I'm not saying we're going to follow exactly that course, but you can see the same type of people in high office now would probably do the same sort of things.
Paul always reminds me that we should learn from our history. There are parallels between the 1930s and the economic situation the world is facing today. The move internationally to populism and the right is sustained by lying politicians. We heard some of those earlier in the programme. And a compliant media which exists in the main to endorse the ethos of capitalism. One person who saw firsthand the consequences of fascism was the late Tony Benn. When I interviewed him in 2007, he made a number of interesting observations.
During the war, of course, when I joined up, we had a totally new experience. My dad had been MP for East London. I've forgotten to mention he was an MP for Tower Hamlets, and very, very deeply involved. He was supported by the Stepney Trades Council, and so on. This was before the Labour Party had really got very far, and he joined the Labour Party in 26, a year after I was born, and he was on the left of the Labour Party. That was his position, as good radicals were. But then during the war I went into the Air Force, and on the troop ship going out to South Africa to learn to fly, we just talked all the time. And I've never forgotten those discussions, because war is very, very, very dangerous sometimes, but the rest of the time it's very boring, and when it's boring you talk. And what we said to each other I have never forgotten. People said, well, look, in the 30s there was mass unemployment, there was the means test, there was fascism, there was rearmament. We don't have unemployment in wartime. If you can have full employment by killing Germans, why can't we have full employment by building hospitals, building schools, recruiting nurses, recruiting teachers? And that's how the welfare state came. Then I came back in 45, campaigned in the election. They wouldn't let me vote in 45 because I was only 20. And I must say I thought it was a bit bloody much, because I had been in the Air Force. I never killed anyone, but I had I'd been in the Home Guard, I'd been in the RAF, I'd been in the Fleet Air Arm. They wouldn't let me vote. You're not 21. So my commitment to that. And then, of course, I was elected to Parliament 57 years ago yesterday. I took my seat. And as a Member of Parliament, then you were exposed to a completely new set of influences. Every day people come and see you, or every week. I used to sit there every Friday, and people come and say, Tony, I'm 80, my husband had died, I need a bungalow. Tony, my granddad can't live on his pension. Tony, my granny can't get a hip operation. Tony, my son's unemployed. And so you had to deal with their problems, and it was out of that you began to ask yourself, well, why is it like this? Why can't people get hip operations, live on their pension, have a house to live in? So that produced a practical input. And then, of course, as a minister dealing with enormous multinational corporations, you realised where power was. So I became a socialist by experience. That's the point. And in a way, when I read the Communist Manifesto, I was a bit cross that he'd thought of it first, because it was so obvious this was the proper explanation of the world in which we lived.
Tony Benn talking to me there back in 2007. It's a little-known fact that the Communist Manifesto has been reprinted a number of times by the Labour Party. MPA member Terry Harrison lent me a copy of the Labour Party edition recently, and it had an interesting foreword to it by Harold Lasky, where he discussed the authors of the manifesto, their background, and the development of their ideas. The Labour Party published it first in 1948 to mark the centenary of its publication in 1848. I wonder if Keir Starmer has ever read it. Perhaps I should send him a copy. The secretary of the Merseyside Pensioners Association, Audrey White, recently attended a Zoom meeting organised by health workers on Merseyside calling for a 15% pay rise. She explained what the NHS means to pensioners on Merseyside.
And we've made the NHS campaigns the heart of our political activity. Goes without saying that we totally support your campaign for a pay increase, but also for a fully staffed National Health Service, fully staffed on decent pay for all people, and trade union rights with it for all people in the NHS. And this fact that we're locked down is a nightmare for all of us. And I do think somewhere along the line, you know, that there is maybe an avenue for civil disobedience, to be honest with you, because here we are trapped, you know, with the most vicious, undemocratic, right-wing government verging on fascist, and we're locked down. We've got to be very responsible in what we do. But I do think maybe on the agenda we should be thinking in terms of how can we safely, in terms of, you know, distancing and so on, and keeping ourselves safe, is to make sure that our voices are heard. Nurses have gone on strike in the past. This idea that nurses never strike. Our secretary, Mary Harrison, she was the secretary for 5 years and helped to build the Merseyside Pensioners Association. She was at one time the only picket on a picket line when the nurses were out on strike in the 70s. We have to look at the anti-trade union laws. because at one time nurses could rely on other sections of workers to come out on strike. And that's where our Labour governments and the Tory governments join forces and crucify people who are so respected by the working class. And they know they will get support from the working class. So what did they do? They tied their hands with laws that drive your wages down, laws that drive all sections of workers down, because once you can't show solidarity, you're isolated. And you, in a profession like yours, where you're in a caring profession, you are blackmailed into having low pay, bad working conditions, and feeling like you can't fight. This is one of the worst things that happened to the trade union movement. It crippled us. It tied our hands. And we had dockers and miners coming out in support, marching side by side with nurses, you know, in the 70s. They were the good times. And we've got to fight these anti-trade union laws. Our chair, and she's a fantastic chair, Julie Lyon-Taylor, her husband, I'm sorry, I'm a bit upset. Her husband died. I have to say that she is absolutely devastated, but so proud of the health service. She said the nurses and the doctors, nobody could do too much for her husband. And they worked past their shifts. When their shifts were ended, they refused to leave to look after Robin. So, you know, we have nothing but respect and fire in our bellies, to be honest with you, fire in our bellies to fight back over, you know, the destruction of our health service, the driving down of low pay of people who are so valuable to all of us, never mind in a crisis, but particularly so under this murderous COVID pandemic. So I think what we've got to do is move forward, but be more radical. Your hands are tied in terms of nurses and so on, in terms of being able to fight for yourselves. And we've got to make the rest of the movement move with you, move on your side, and build organisations and campaigns that unite us, particularly on an issue of the health service. I think it's something that's close to everybody's heart. Be assured the Merseyside pensioners, in whatever way we can, through our podcasts and our campaigns, join in all the campaigns that are going on, that we'll be by your side. As angry as we are and as restricted as we are, we will do all we can. So full support to your campaign.
Audrey White there, and it goes without saying that we all send our condolences to the chair of the MPA, Julie Lyon-Taylor. I spoke to her recently and she told me that she's keen to get back into the campaigning mode and expressed her concerns about the crisis in care homes on Merseyside and across the country. We will be hearing from Julie in our next podcast. Also at the meeting Audrey attended was another student nurse called Kelly.
Decent pay equates to dignity and well-being. During March, whilst working on a COVID ward, I was in the lift in the morning and I sobbed. The previous day, I'd been in about 6 COVID patients. I was giving a patient hygiene care when on the radio it announced that a 33-year-old nurse had died. I was giving care to another lady in the same bay who had dementia. She kept asking me when her family were coming to see her, and she kept asking me, repeating the question, and I kept answering her. They can't come at the moment, I'm sorry. They can't come at the moment, I'm sorry. They can't come at the moment, I'm so sorry. I sobbed for that woman and for the rest of the patients and their families, and I sobbed for that nurse and her family and her colleagues, whose grief and PTSD and work has now been completely disregarded by this government. And during lockdown, as I walked home from my shifts and I live in the city centre, I looked into the eyes of the homeless, whose desperation nearly palpable, faces I recognise as they come to the hospital regularly and we care for them. The disease is a manifestation of this austerity from this government. I've worked for many NHS trusts now, and I can categorically state that the workers and my fellow nurses, all colleagues, are kind, strong, intelligent, courageous people, but we're all very stressed. Caring for people is our duty as humans. It's also very rewarding and a privilege, but it comes with a lot of responsibility and a lot of stress. Stress is so much that as soon as you step over the threshold into the hospital, your blood pressure increases. And you spend the day juggling a million tasks, giving physical and emotional support to those who need us. And at the end of the day, our bodies ache and we're in this altered manic mental state. If we go home and we can't de-stress because we're worrying about paying the bills or how to feed our children, we're just left in a chronic state of stress and ultimately disease. And it's an absolute disgrace that in 2020 NHS staff members are using food banks. BM Hedge said, don't get sick, rich in the sick room. And I know that none of us could ever be accused of this. For me, this is not about wealth, it's about our health and well-being. And it's about a fair wage that reflects the weight of the role that we perform. Boris Johnson, our colleagues cared for you when you needed us. It was their duty. You have a duty of care to us. We carry your heavy burden. Meet us halfway, raise our pay. Thank you.
That was student nurse Kelly, and it really is difficult to follow that with any comment. You can listen to all of the Merseyside Pensioners podcasts by going to the Merseyside Pensioners YouTube channel. There's also some films you can watch featuring the campaigning work of the MPA. You can also hear us each week on Liverpool Community Radio FM 106.7 or online. You can also find the MPA podcast on Spotify and Anchor.fm. Now, on an entirely different matter, yesterday I had a problem with a leaking tap. So I phoned up my old friend Jerry the plumber.
Merseyside Plumbers.
Hi Jerry, it's Phil. I'm just wondering if you could come over sometime to have a look at my tap, which is leaking quite badly.
I'd like to, Phil, but I'm absolutely up to my ears in it. I tell you, I don't know what's happened. But I was doing some work down in Tower Hamlets recently, and this bloke called Honest Bob Jenrick phoned me up. And since then, the phone has just been ringing all the time. I'm having to go all over the country, these people. I'm over in West Sussex at the moment. Some bloke called Matt Hancock's house. Unbelievable it is. He phoned me up. He said he wanted his boiler service. So I said, well, whereabouts is it? He said, West Sussex. I said, that's a bit far for me. But I said, all right, I'll do it. And he said he wouldn't be there. So he gave me the number to his key code. And he said I could have unfettered access to his house when I got there. Unbelievable. I could barely get in the front door. It was like one of those, you ever see those programs from Channel 5, hoarders. It was unbelievable. When I managed to get in the front door, there were just boxes and boxes and boxes of surgical face masks all in the hall. And going up the stairs, trying to find the bloody boiler. I fought my way into the kitchen over all these plastic visor things. I don't know what he does for a living, this Matt Hancock. He seems as if he was some kind of trader or something. I have no idea. So yeah, I've been there for 4 days, Phil. I still haven't found his boiler. Yeah, so I don't know when I'm going to be able to get round and do your dripping tap. It's just unbelievable. I don't know what he does, but Yeah, I went out the back, see if I could find the gas meter, and there's his garage. Well, it's not really a garage, it's more like a kind of warehouse, really. And inside there were these things, they looked a bit like iron lungs. I don't know what they were, I don't know. Maybe something on there said something, a ventilator or something, but there was hundreds of them all stacked there in this bloody garage of his. Then I came across these things, these printed handbooks it was, and on the front it said, "Don't kill Granny or Grandad." And then it said, "Let us do it with our newly privatised health and social care locations. Give us Granny and Grandad for 6 months and we can promise you that after that time you won't have to visit them anymore." Unbelievable. So, yeah, Phil, I'm not quite sure when I can get round to you to do your leaking taps. Well, once I've found this bloody boiler at Hancock's, I've got to go over to Uxbridge and South Ruislip. Some other bloke called me up. I couldn't understand a word what he was saying on the phone, but I will go round and sort that out. So I think you'll probably look in a couple of weeks, Phil, for your dripping tap. Is it bad?
Well, it's not as if I'm being flooded, so I suppose I can wait.
Well, you know, I always try and help out friends, but I tell you, this honest Bob Jenrick, God blimey, he doesn't put a lot of work my way. He really does, you know. But yeah, I don't even know when I'm going to see this Matt Hancock to get my bill. 4 days I've been here. He said he had some very important meetings with some American healthcare insurers or something. I don't know what that was about either. But yeah, well, I'll tell you what, Phil. Maybe give us another ring at the end of next week. Hopefully, by which time your house won't have flooded. And I'll just have to see what I can do then.
Well, I'll keep you posted about my plumbing problems in the next podcast, where Jerry will no doubt be giving me an update about his work in Uxbridge and South Ruislip. Every Christmas, the MPA has a party for its members and their guests, so I was pleased to be able to interview the Health Secretary, Matt Hancock, earlier and ask him if he thought we would be able to have a Christmas party later on this year. Mr. Hancock, thanks for coming on the programme. There are millions of people in this country who hold you and your lousy government responsible for the needless deaths of thousands of people. We'll come back to that in a minute, but first of all, this is the time of year when the MPA starts to plan for its annual Christmas party. Do you think our party will be able to go ahead this year?
Well, I hope that if this mass testing regime comes off, if the new technologies we're working so hard on work, or if we manage to get a vaccine between now and then, which we can't rule out, then I hope we can have a happy and loving Christmas that people yearn for.
Well, it's not been very happy and loving for the thousands of pensioners who have died because of your disgraceful stewardship of the NHS. Frankly, I don't think anyone listening to this thinks that the MPA will be able to have a Christmas party. Is there anything you can say that might change our pessimism?
We have the cavalry of the vaccine, which is still coming towards us, but it isn't here yet.
No, it's not there, is it, Mr. Hancock? So let's talk about what you like to call NHS track and trace. We all know it's got nothing to do with the NHS. In fact, why don't you just take off that badge you're wearing on your lapel and replace it with a Serco badge? Just tell us what you're doing about testing and tracing.
Well, clearly, we have expanded the testing capacity in this country enormously over the past 6 months.
Really? Really? The testing and tracing which you've launched, relaunched and renamed during the last 6 months has been an abject failure.
There are, of course, some operational challenges in a system that's as big as that. The key message I want to get over to your listeners is that the vast majority of people are able to get a test close to them or at home, as you mentioned, which is available also.
No, that's all lies. You're lying.
Well, no, because the vast majority of people, wherever you are able to get a test close.
No, Mr. Hancock, that's not true. You're lying again. There is no point in carrying on with this interview if you're just going to lie. Can I just ask you about care homes? You promised back in June that there would be testing for all staff and residents of care homes. Why has that still not happened?
Well, that is starting to be rolled out now. We had an operational problem there with one particular supplier of tests that supplied tests into that programme. And when you have an operational problem like that, which actually it was that the test kits were not fully clean, they didn't pass our cleanliness tests. Obviously, I don't want to put unclean tests into care homes. And so we paused that programme whilst we sorted the problem out, and now we're able to get on with the rollout.
Rollout? Rollout? I'll tell you what's being rolled out, Mr. Hancock. It's the residents of care homes, because care homes are closing down all over the country, and their vulnerable residents are dying as a result. I'm really sick of this interview. Is there anything at all you can say that can justify your existence as health minister?
The moonshot, the moonshot, as we call it, the moonshot.
Well, it appears that Mr. Hancock has left us for the moon. What a great shame. I hope you've enjoyed this podcast from the Merseyside Pensioners Association. In our next podcast, we will be looking at care homes in the UK and the fight back against closures. Until then, this is Merseyside pensioner Phil Maxwell saying goodbye for now. Stay safe and solidarity. I leave you now in the musical hands of Merseyside pensioner Phil Newton.
So Phil, this is when you're smiling again.